announcements to make before we begin. Any citizen desiring to address the hospital board should turn the speaker card to our board secretary. If the citizen comment pertains to an item on the agenda today, the comment will be heard early in the meeting. Otherwise, it will be heard toward the end. Speakers are asked to limit their comments to 5 minutes. Vendors, suppliers, or other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation for bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments or discuss or negotiate claims at this meeting. The other announcement is I want to note that although the governor's order regarding establishing a quorum via virtual attendance has expired, some of our members are appearing via telecom conference today. We do, however, have a quorum the state and federal recommendation. Regarding the social distancing related to the current public health emergency, we are also continuing to streamline our meeting process to avoid non-essential items from our consideration. And with that, we'll proceed. Seek approval of the orders of the day. Ask for a motion to amend the order of the day to add item D under the report of the medical staff regarding elections of medical staff officers and department chairs. So I seek an approval for that motion. All in favor, please respond by saying yes.
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 Opposed? Yes, it's carried. And subsequent or followed up to that, I'd ask for a motion to approve the amended orders of the day. I seek approval, please. Second, all those in favor respond by saying yes.
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 Opposed? Motion carries. Okay, the next item on the agenda is election of board officers. This is our annual organizational meeting, and at this meeting, we elect the officers of the board, chairman, first and second vice chair, secretary, assistant secretary, treasurer, and assistant treasurer. Do I have a motion for an election of the slate? Second? You should go first. Sorry. So Greg Carter, as chair of the governance committee, will make the motion for the slate and ask for second approval. Sorry.
At this time, I'd like to move election of the following slate of officers for the 2024 year. As chairman, Jim Meister. As first vice chairman, Sharon Wexler Peters. As second vice chairman, Britt Reiner. As secretary, Sarah Lodge. As assistant secretary, Greg Carter. As treasurer, Joe DiVirgilio. And as assistant treasurer, Daryl Henry.
Okay. All those in favor, respond. I'm sorry. Got a motion. Second, thank you.
Second.
All those in favor, respond by saying yes.
Yes.
Opposed?
Yes.
Opposed.
Daryl?
Opposed.
Opposed, okay. The ayes carry it. And I'm sure I thank all the members of the board and my members, people, place of election appointed to. Thank you, and also, we did not approve the minutes of the meeting of October 9th, 2020. I would like a motion approving these minutes. I have a second. All those in favor respond by saying yes.
Yes.
And the yeses have it. Thank you. Report of the medical staff. Dr. Wazen, please.
Yes, sir.
Well, welcome, Dr. Rosman.
Thank you. Good afternoon. So this
You sure you
afternoon,
want
I
this,
have
huh?
several motions for you today from the medical staff office that I understand will be made by Sharon Wetzler Peters as chair of the quality committee.
Thank you, Dr. Watson. As in item A, we have approval of a policy. First of all, I move approval of the organ and tissue donor procedure policy as recommended by the Medical Executive Committee. Next, on item B, is approval of several sets of department rules. I move approval of the anesthesia, medicine, neuroscience, obstetric gynecology, pathology, and radiology department rules as recommended by the Medical Executive Committee. As in item C, approval of several privileges forms. I move approval of the neurosurgery, otolaryngology, trauma services, and physician fluoroscopy, ionized radiation privileges form as recommended by the Medical Executive Committee. And finally, item D, I move approval of the 2019-2020 Medical Executive Committee roster, including the medical staff officers and department chairs as elected by the medical staff and recommended by the Medical Executive Committee.
So you guys can
Sharon,
take those all as a
would you read C again, please?
So you can take them all as a group and do it all together. And
No,
then
I don't.
think
I don't want to take them all as a group. I want to hear C again.
I think that C, pathology, was not necessarily included in the list, and it should have been. It might be deleted on your list, but pathology.
Seems like to me accepted a third-party group
C,
as in the group. I'd rather not accept a whole group.
So one,
Was that not what I understood?
Daryl?
Didn't-
Daryl,
Yes.
let's do what you have requested. First, would you reread number C, Sharon?
Yes, I will. Now, item C is recommendation to approve neurosurgery privileges form, ENT privileges form, pathology privileges form, trauma services privileges form, and physician fluoroscopy ionized radiation privileges form.
So, Daryl has asked that we approve each of these recommended changes individually. So can we do that without having to read the information attached to them? Is that okay with the board? Anybody
I can
opposed
do
to
them
that?
separately if you wish.
I don't think it's necessary that you read them all over again.
Hey, this is Joe D. Daryl,
Yes.
do you now understand what item C is? It's strictly approving the forms. So with that clarification, would you be willing to take A through D in one motion?
It approves a third-party group as having
No.
permissions.
No, it's approving forms by each of these departments.
Oh, just the forms.
Just all we're doing
Yeah,
is
okay,
the
I'm
forms.
good with that.
All right.
Okay,
that's-
so we can take them all together now, Jim.
So can we shoot, you're saying, Joe, take A and B first?
No. Based on what we just clarified for Daryl, he's willing to take A through D in one recommendation now.
Absolutely.
Just so everyone's clear, it's recommendation to approve the policy, the recommendation to approve all of the department rules that were listed, a recommendation to approve the privilege forms that were listed, and a recommendation to approve the medical staff leaders for the 2020-2021 medical staff year.
Okay, and if so, can I have a motion to that effect, please? Second, all in favor, respond by saying yes.
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 Opposed?
Yes.
Motion is carried. Thank you. Sarah Lodge, would you give us the secretary's report, please?
Absolutely. Hi, everybody. Can you hear me correctly? Can you all hear me?
Yes.
Yep.
Okay.
Yes.
Clear.
Great.
Yes.
Great. For our next board meeting will be on Monday, December 21st, 2020. We will start at 10 a.m. with the Governance Effective Committee. Then at noon, we will have the closed session hospital board meeting. From 12:30 to 2, the board lunch, issues and financial review. From 2 to 4, the board meeting. And then from 3:30 to 4:30, corporate compliance immediately following the board meeting. Any questions?
Thank you, Sarah.
Sarah, how much
None.
was allotted for governance?
From 10 to noon. Sorry, I should have included that.
I guess the only question, why do we need so much time for governance? Over.
This is Joe D. We put that in because that's going to be the evaluation of David's performance.
Okay. All right. I got you. I'm with you. Okay. Got it.
Good. Mm-hmm.
I'm going to be there, and I'm going to be a pain in the butt.
You're going to be here in person?
I'm going to be there in person. I'm going to be a pain in the butt.
Welcome back.
Well,
Yeah, right.
We'll take you in. We'll take the first part. We'll take you in person. I'm not sure we're going to agree to the second part.
I got that.
All right.
It depends
Anyway,
on
let's
where the
move on.
COVID. It depends on where the COVID numbers are.
Charity care. Joe, did you hear me?
I'm sorry, I didn't hear you.
Mr. Chairman, this is Gerald. Point well made. Advice accepted.
Here you go. Are you ready for the treasurer's report?
Debt and charity care, Joe.
Okay. I move approval of the bad debt and charity care for the month ending October 31st, 2020, in the amount of $16,586,000.
Have a second, please? Second, all in favor, respond by saying yes.
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 Opposed? Motion carried. Thank you, Joe.
Thank you.
Bill Bolton, our Chief Financial Officer, on highlights, please. Bill.
You've got the financial highlights for October, and we'll start out with the total revenue for the system in the rating agency format. And keep in mind that October is the first month of our fiscal year, so the fiscal year-to-date numbers I won't cover because they're the same as the month. For the month of October, we had total revenue of $89,351,000 compared to a budget of $88,978,000. Looking at expenses, the total expenses for the system in the rating agency format for the month of October, $84,194,000 compared to a budget of $84,071,000. The operating income for the system rating agency format was $5,157,000 compared to a budget of $4,907,000. Our operating margin was 5.8% compared to a budget of 5.5%. Looking at statistics for the hospital for October, the average daily occupancy, 591 patients per day compared to a budget of 541. The average acute length of stay was 4.69 days compared to prior year, 4.09 days. Admissions, we had 3,445 compared to a budget of 3,803. And surgery cases, 1,901 compared to a budget of 2,096. 303 births in October compared to a budget of 347. The outpatient registrations for October, 37,519 compared to a budget of 39,925. And between our two emergency care centers, we had registrations of 8,464 compared to a budget of 10,180. And in October so far this year, our case mix index for all patients 1.86 and for Medicare patients 2.0. That concludes my report unless there's any questions.
Any questions?
I have a question, Bill. May
Yes,
not be
sir.
for you, may be for Dr. Kazem, but when you talk about surgery cases, are you talking about opening the skin?
It would be an opening of a surgical,
Procedure required, a procedural consent form.
a surgery requiring a surgical consent form, Daryl.
There are other procedures other than opening the skin that count as surgery. Is that correct?
Yes, Daryl, this is Jim Fiorica. Yes, so it would be the surgical consent form for a procedural event. That may be laser, it may be radio ablation.
Very well. Thank you.
Thank you, Dr. Fiorica. Let's turn to committee reports, mission and planning committee. Greg Carter, our chair.
Thank you, Mr. Chairman. The Mission and Planning Committee met this morning after approving the minutes of its August 17th meeting. Chief Information Officer Pam Ramhofer provided the committee with an update on the Most Wired Award and the IT security strategy. This is Sarasota Memorial's 4th consecutive Most Wired Award. Next, Pam shared an update on the IT security strategy, which is multi-phased and comprehensive, designed to ensure data security across all platforms. Pam concluded the presentation by discussing the next steps to continue to support and expand the IT security strategy. For the next presentation, David Patterson, Associate Chief Nursing Officer, and John Saul, Director of Facilities Management, presented on the surgical renewal project. The presentation specifically focused on the renovation of 5 operating rooms. Currently, the general operating rooms are approaching 25 years in age and are in need of an upgrade to meet the surgery demand. The newly renovated operating rooms will include state-of-the-art equipment that enhances air quality, enables precise location of equipment, and increases cleaning efficiencies. Based on the presentation, I move approval of the cost of the renovation operating rooms 2, 17, 18, 19, and 20 as budgeted in fiscal year 2021, with the total project cost not to exceed $9,990,000 as recommended by the Mission and Planning Committee.
Can I have a second, please? Second. All those in favor respond by saying yes.
Yes.
Opposed? Motion carries. Want to continue, Greg?
Okay. The final presentation to the committee was the ranking recommendations for the design and construction of the behavioral health pavilion. Tom Perigo, Director of Architecture and Construction Services, presented the top 3, each of design and contractor firms. At this time, I move approval of the ranking of the following entities for general contractor and design team services for the behavioral health pavilion as recommended by the Public Selection Committee and the Mission and Planning Committee. For general contractor, first was DeAngelis Construction, second Brassfield, and third Creative Contractors. For the design team, Gresham Smith first, second was EYP, third was Callison RTKL.
May I have a second, please?
Second.
All those in favor respond by saying yes.
Yes.
Opposed?
Yes.
Motion carries. Thank you, Greg. You're still up on effectiveness committee.
On the Governance Effectiveness Committee, as reported earlier, the Governance Committee met this morning after approving the minutes of the Committee's June 15th meeting, the committee discussed the board officers for the 2021 board year, the slate of which was passed earlier in this meeting. Next, the committee discussed the board member preferences for committee assignments for the year, and those will be voted on at the December board meeting. The committee also discussed the community members of the various committees. As the next order of business, the committee discussed the board calendar. And at this time, I move approval of the board calendar for the 2021 board year as recommended by the governance committee.
Have a second, please.
Second.
All those in favor respond by saying yes.
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 Opposed? Motion carries. Thank you, Greg.
Finally, the committee heard a report regarding the systems compliance program by its compliance officer, Lisa Totten. The committee discussed the system's robust compliance structure, including the oversight, education, monitoring, reporting, enforcement, and risk assessment functions the system utilizes to ensure compliance with the multiple laws, rules, and regulations governing its operations, as well as its plan to continue these for the next year. And that concludes my report, Mr. Chairman.
Thank you, Greg. Finance Committee, Sharon Wetzler Peters, please.
Yes, thank you, Mr. Chairman. The meeting of the Finance Committee met this morning where the minutes of the August 17, 2020 Finance Committee were approved. Next on our agenda, Bill Wojin, CFO, presented for approval the updated list of recurring wire transfers in ACH and other payments for the hospital, which is done every year. Bill described the control mechanisms, both internal and external, which are in place to ensure only properly authorized transactions occur. At this time, I move approval of the list of recurring wire transfers and ACH and other payments to authorize
Second.
staff and authorize them as needed, as recommended by the Finance Committee.
May we have a second, please?
We have a second.
All those in favor respond by saying yes.
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 Motion carries.
Yes. Tram votes yes.
Next on our agenda was a presentation by George Red H.E., Director of Health and Management, who gave an update presentation on the department, its functions, and upcoming projects. The HIM department has 85 employees with many different credentials and certifications who are responsible for maintaining patient records and ensuring data integrity. The two major projects for the coming year are preparing for the opening of the SMH Venice Hospital and converting old microfilm patient records to electronic storage. There is no motion necessary. This is for our information only. And lastly, the presentation was by Charlie Ryan, Director of the Central Business Office, who gave an update presentation on the revenue cycle process for First Physicians Group. The CBO team performs the billing and collecting for 189 physicians and 69 advanced practice professionals. The team is responsible for revenue capture, demographic information integrity, coding edits, denial identification and resolution, and managed care contracting. There is no motion necessary. This is for our information only, and this does conclude my report, Mr. Chairman.
Thank you, Sharon. Next up, David Barrender, our President and CEO. David, please.
Thank you, Mr. Chairman. I'm going to start today, as we always do, with our organizational report card for our fiscal year to date, 2021, which this is our first month of that fiscal year. So we'll start in the service category and look at our likelihood of recommending. Our goal is to have a number of, is to have 8 out of our 10 service areas at or equal to or greater than the 75th percentile. Happy to report that we're hitting 9 out of 10 on those, and I will show you the detail here in a minute. In the people category, we have a new hire retention, a percent of regular full-time and part-time employees hired in fiscal year 2021 that are still employed by the end of this fiscal year. We have a goal of 83% or greater. Yes, 1 month look right now, so we are exceeding that. That'll normalize itself out over time at 91.54%. In the quality section, we have our infection prevention, our combined overall standardized infection rate our goal is being less than 0.88. Happy to report we are exceeding that at 0.76. So our quality is staying well below the national medians. In the finance area, as you heard our CFO Bill Wojcik report, we have our goal of having our operating margin be at 5.5%. And right now we are projecting we're hitting right at that at 5.5%.
Thank you.
In the growth area, we have 2 goals. The first being our inpatient admissions and observation outpatients. We have a goal of being at 51,164. We are modeling lower than that at this point at 46,059. And our second one being outpatient registrations, our goal is being 977,000. We are modeling that we are coming in lower than that as well at 879,000. Looking at our patient experience report card in a bit more detail, this is our likelihood of recommending in the 10 different areas that we survey. The middle column is what our actual FY 2021 year-to-date score is, which happens to just be for October. The next column over is the national median score, and then finally what we compare ourselves against, which is the 75th percentile. Happy to report that we are exceeding our goal and having 9 out of 10 departments exceed the 75th percentile. 2 that we have had that have been close but not there in the past have been the ER Center at SMH and Northport, which are now both exceeding the 75th, and the one that's missing just a little bit is First Physicians Group by 1 point. SMH celebrates 95 years of service. November 2nd marked a milestone, our 95th anniversary. Many thanks to all the hospital board members, staff, physicians, volunteers, and community members who have contributed to making our success over these 9.5 decades. Had just a small, we were able to share that on YouTube, and we hope in 5 years from now we will all be celebrating in person, our 100th anniversary. Next, SMH opens a new digestive health center. On October 14th, SMH opened a new outpatient center on Hillview Street that includes a state-of-the-art endoscopy center and specialty practice dedicated to the early detection and treatment of gastrointestinal cancers and other digestive diseases. The endoscopy center will help reduce the wait time people are encountered when trying to schedule procedures outside of the hospital setting, and will also play a key role in supporting the Brian D. Jellison Cancer Institute. SMH recognizes our physicians on the front lines. At last month's annual medical staff meeting, Sarasota Memorial honored physicians who have helped lead the fight against COVID-19. Chief of Staff Alyssa Schulman presented the 2020 Physician of the Year Award to physician leaders representing the extraordinary work of the medical staff to safeguard patients, hospital staff, and the community this year. A number of physicians who were spotlighted for their tireless efforts and leadership throughout the crisis include our own Chief Medical Officer, Dr. James Fiorica, our Medical Director of SMH Infection Prevention and Control, Dr. Manuel Cordillo, our past Chief of Staff and Critical Care Pulmonologist, Dr. Joseph Seaman, and our Medical Director of Clinical Research, Dr. Paul Volker. Congratulations to all of you, and thank you for your continued work. Our cardiologist earns a Lifetime Achievement Award. Sarasota Memorial's medical team also honored the interventional cardiologist, Dr. Michael Muma, with a Lifetime Achievement Award at the annual medical staff meeting. Dr. Muma, who joined SMH's medical staff in 1989, was recognized for 30-plus years of clinical leadership exemplary service, and unwavering commitment to his patients and community. So we just want to once again congratulate Dr. Muma on that recognition. SMH installs our new physician leaders also for this year. The following physicians will serve on the hospital's medical executive committee for 2020 to 2021. Our own Dr. Jack Wasson, who's with us today, was named Chief of Staff, serving as top representative of Sarasota's more than 1,400 medical staff members and advanced practice professionals. Dr. Richard Lichtenstein was named Chief of Staff elect, while Dr. Joseph Seaman was named Secretary and Treasurer. Dr. Chippy Echelin and Dr. Itun Okanobi were also named members at large. So a special thanks to all of our staff and our ongoing efforts to show gratitude to staff for their dedication through this pandemic. Special appreciation goodies were given to everyone last month. We want to thank Travis and B&I contractors for their contributions to this process. And thank you to our staff. Virtual series of classes help staff cope. Our employee assistance program partner, Health Advocate, is presenting several webinars this month to help staff manage pandemic-related stress, seek support, and build resiliency. This is just another way we're supporting staff for going above and beyond in these challenging times. Resilience, sorry. Inpatient rehab undergoes successful survey. The Commission on Accreditation of Rehab Facilities recently surveyed SMH's inpatient rehab program under the Medical Rehabilitation and Stroke Specialty Standards of Care. Our program earned successful reaccreditation for 3 years and received no recommendations for improvement. Fewer than 3% of CARF-accredited programs achieved one deficiency-free, but SMH received no deficiency for a second survey in a row. So congratulations to Maria and her whole team out there. Construction progress in our Venice campus, our SMH Venice. Our new campus remains on schedule to open in the fall of 2021. Recent constructions include a cooling tower piping and ductwork installation in the Energy Center, a drywall and primer work in the Emergency Care Center and operating rooms, terracotta framing installation on the exterior, and our underground power lines at Laurel Road are energized and the removal of overhead power lines will begin. The construction progress on our Oncology Tower last month. SMH marked construction progress on its new Oncology Tower with inspiring words of hope as a small group of hospital staff, construction workers, and others dedicated to the project took turns inscribing special messages on a banner attached to the concrete wall in the tower lobby. The banner will be sealed by a sheet of drywall and will become a permanent part of the building, which is scheduled to open in the fall of 2021. In recognition of the recent landmark $25 million gift from the Brian and Sheila Jellison Family Foundation, SMH's Cancer Institute is now known as the Brian D. Jellison Cancer Institute. And Mr. Chairman, that is my report. I am happy to answer any questions.
Any questions for David? Thank you, David. Karen, do we have any requests to speak?
No, sir, we do not.
Okay, thank you. Legal matters, Carol Ann?
I have no report.
Having completed our agenda, we stand adjourned.